limbs. I always carry 4 tourniquets in all of my kits, because if somebody puts 4 tourniquets on you and you only have 2, you're actually going to be taking their tourniquets. Okay, they'll use yours first, so I always carry 4. And I want to make sure that somebody who walks up on me can tourniquet all my limbs if I go down. So it's more of a self-preservation thing. Tourniquet the limbs, and then start bandaging their head and chest. There's a bunch of medical guides out there on which bandages to work. But if you are not a medic, do not use elastics. Because those, while they cover like a large wound very quickly, you can apply one, it will cover one large wound. So it bandages them very fast, but it also dissipates very fast. So you'll be working on somebody, if you only put elastics on, within 1 to 2 minutes, those bandages will go away and they'll start bleeding again. So it's kind of a pain in the ass. If you are a medic and you use elastics, sometimes I'll have all the limbs tourniqueted. So tourniquet arms and legs, I'll elastic their chest and head very quickly. And if they're not major injuries and you can keep your stitch time to like 16 seconds or less or so, then I'll just elastic chest and head and then stitch them right away before I do anything. Okay? Now, a lot of these things I'm telling you, these are just kind of the way I do it to kind of speed things up. So you'll find your own ways, and lots of people have different opinions, but this is kind of just what works best for me. So once you get them stitched, don't even worry about the limbs. Just leave them yellow, okay, or red, or whatever they're at. Especially if they've only lost some blood, or even a large amount of blood. As long as they're not on fatal, you can still get a heart rate. So just work on getting a heart rate first, and then once they have a heart rate, then you can go back and fix all the limbs to either get an IV in, or to get them to fully patch them up, okay? A lot of guys waste time on trying to bandage those limbs when they have a tourniquet on them, and it's just not necessary. Okay, make sure the head and chest is good, and then just start working as a heart rate. Now, when we're doing CPR, your role depends on how, what % chance of success rate CPR will have. So if you are not a medic, you're just a rifleman, anything but a medic role, you have like a 40% chance for CPR to work. Now, sometimes you have to do CPR like 15 times. It seems like they're never going to come back, but just keep at it, okay? If you are a medic, if you see a medic just standing by and there's nothing left to do on them but CPR, you want to take over, okay? Because you'll increase the chance of CPR. Goes up to, what is it? Hold on, I got to look this up. If anybody knows off the top of their head.
What are you looking for? Because the CPR for non-medic roles is 20%.
It's 20%. Yep.
And then 30 and then 40 for medic,
30
then
for
doctor.
Medic, and then 40% is doctor. Now doctor would be Banshee or
1-9
or 2-9. Okay. So if you have a
microphone muted, microphone activated.
Epi, then you can still do CPR.
Yep. So epi increases the chance of CPR being successful by 10%.
5% is what we have in the medical doc.
Okay, 5%. Yep, I see it. 5%. It's not a whole lot, but it is something. Okay, so another thing about epi, don't worry just pop an epi right away. Okay, you cannot OD on epi if you do not have a heart rate. You could give them 100 epis, and it's not going to change anything. Okay, it's not going to OD them, it's not going to kill them. So just pop an epi. Even if somebody already did it, doesn't matter. Just pop one. The way the server is set up, the only time you can there is no set number to OD on any medications. You'll only OD if said medications have lowered or raised your vitals to a dangerous level. Okay, so you could just keep giving somebody epi who has a heart rate, and they're not actually going to go unconscious until their vitals get up above. Shit, it's high. It's like
220 if I remember correctly off the top of my head, but I could be wrong on that one.
I think it's somewhere between like 185 and 220 depending. Okay, so you have to give them a bunch of epi. So if somebody says no, I already gave them one, don't worry about it. It's not that big of a deal. Nothing to worry about. And we'll get into adenosine a little bit later, but adenosine is the same thing. As long as you're not dipping their heart rate below 40, then you can just keep popping adenosines, and there's going to be no negative effects from that. Okay. So somebody's uncon, walk up, pop an epi. First thing you do, if somebody's doing CPR, just pop an epi. If you're a medic, it just gives them a little bit of a chance. They last for 2 minutes, so the most efficient way would be to just keep giving an epi every 2 minutes. I believe CPR is like 15 seconds for a round, so you'd have to give them, 4 rounds, 8 rounds of CPR, if my math is correct, and then you'd want to pop another epi, okay, after 2 minutes.
Yeah, 8 rounds.
Yeah, if you ever forget, on the medical menu, the very left side is the triage card. That will tell you in real time, not game time, but real time, how many minutes since the last time something was administered. So if you look there and it says epi 3 minutes, then go ahead, pop another one. If it says 2 minutes, just go ahead, pop another one. Okay. I don't think the bonuses stack. That's kind of a hard thing to test for, so I don't think there's any benefit to just giving them like 5 epis. But you just want to make sure that you keep those epis on to get that extra bonus.
Also, Seafolk, to correct something, it is heart rate of 190. It's under the epi tab.
Okay, and that will pass them out?
That is
basically
pass out. Yep.
Yep. Okay. All right, so you have to give them a lot of epis, even if they have a heart rate. So don't get too worried about screwing up and giving somebody an epi. It's most likely not going to affect them in a negative way. Epis can be counteracted with adenosine. So adenosine, it lowers your heart rate, and the amount it lowers there's a range. Let me just pull up my...
I can pull it up. It's 10 to 25.
Channel switched.
And I crashed.
User left your channel. Channel switched.
Hello, hello, hello.
This is why I don't like carrying an AEDX. Okay, 1.9, and especially I feel like the ADX, you're doing yourself a disservice. Number one, it's heavier, so it's going to take up way more space in your backpack.
One thing
And
about
then-
the ADX though, it's a 60% chance. It's 20% more than the normal AD to
Yeah,
get
it's an
back to heart rate.
80% chance compared to a
80%,
60% chance.
Yeah.
So to
you know.
me, it 1.9 is one of those roles where you're on the front lines a lot, and 1.9 does go down a lot. So to me, I feel like you're doing yourself a disservice. You can make that decision on your own, but if 1.9 goes down, you'll have everybody's going to try to get them back up, and if you have the regular AED, it's going to get you up that much faster. Okay.
Okay, sorry about that.
Hey, two-hand, you're hot micing.
Seafolk. Sorry about that. I kind of
So,
crashed. What did I miss?
The only people I really think should be carrying an AEDX is maybe Banshee team lead, because usually you guys are running around in pairs, or even up to 3. So if one of you goes down, typically there's another Banshee member or even 1.9 around that can help get you back up. But especially, I feel like 1.9, if you're out in the field and you go down, having somebody who's a non-medic or even a medic be able to use your AED is like extremely valuable. I don't know how many. Yeah.
Oh, I was just gonna say, after you finish, can you go over what I had missed? I kind of crashed.
Oh boy. How long have you been staying? What's the last thing you heard?
Last thing I heard was
Or the first thing you heard when you came back?
What is it? 80s, why you don't like the ADX, and the last thing I said was I believe it was the epinephrine. Something.
Okay, so we covered. So did you? I was covering adenosine. Did you hear anything about adenosine? Did you hear?
What was it? Oh yeah, as adenosine, I said it decreases heart rate by 10 to 25, and immediately crashed right after saying that.
Okay, yeah. So the big thing with adenosine is I like to just, if their heart rate's like over 115, then I just pop 2 of them immediately. I don't even worry about popping 1 and seeing how low it's going to go. Just pop 2. You can't OD them, and there's no way by giving them 2 you're going to get their vitals to a dangerously low setting. So just pop 2. That's the fastest way to do it. You have to be careful though, and we'll get into kits a little bit later, but epis and adenosine, you can use them very loosely and freely, so you want to make sure that you're carrying a bunch of those. I like to carry, I think, 20 adenosine and 20 epis, but we'll get into that a little bit. With the AEDs, did you hear that if you have an ADX, anybody can use them when you go down if they're equipped?
It was just the AED that can do that. The ADX
Yep.
is for doctors.
AED, correct.
Yep.
Yeah, AEDX, like if you can't carry an AEDX, then you will not be able to use that AEDX on somebody. So that's why I really don't like carrying them as 1.9 or even Banshee, just because if I go down, I want somebody to be able to get me back up. And if I got to sit there and be down while somebody gives CPR on me, and as we all know, lately, sometimes you're giving CPR like a dozen times, 15 times, a long time for some of these guys to come back with CPR. So that AED is extremely valuable. If you don't know how to use an AED, just to go back on that, you want to click on their chest, and then it shows up under the basic treatments menu in the medical menu. Okay, it'll say use AED, and it works just like CPR. You'll do the same CPR animation, and it'll even show a 32 heart rate, or 31 or whatever the weak heart rate is while you're using the AED. Okay, so it works pretty much just like CPR, except it gives the little beeping audible, and it has a much higher chance of reviving the patient. When you're using an AED, just spam the shit out of it, okay? You do not have to, as long as they're not on fatal. If they're on fatal, then you need to push fluids. and we'll get into that just a little bit. But as long as they have blood in them, then you can just keep spamming. Use AED, works just like CPR, and there's been times where I've had to do 6 or 7 times. They'll most likely wake up in severe pain if you have to use an AED more than twice. But I mean, at that point, it doesn't really matter. It gets them up way faster. So don't be scared to keep shocking them. Now, if you accidentally shock somebody who's awake and has a heart rate, you can do that. It's not going to kill them. Okay. So if you shock somebody, they're alive, somebody's screaming at you to stop, it's not that big of a deal. All you're going to do is you'll cause them pain, but it's not going to kill them.
Now,
Okay.
Seafolk, from the way you're making
Yep.
this sound, you make it sound like the AED also does the reorient patient. Is that correct?
No, it does. It
Okay.
does not wake them up. It just gives them a heart rate.
All right then.
There are times where you'll if the stars align and everything's perfect, you'll be doing CPR and they'll just wake up, or you shock them and they just wake up. But that's just getting lucky. It has nothing to do with AED or CPR. CPR and AED work exactly the same. AED just gives you a much higher chance of success.
Got it.
But the mechanics are exactly the same, and the AED
Pain
causes pain.
It's a 2-minute threshold for both the epi and the adenosine, right?
Adenosine lasts for 2 minutes, and so does epinephrine. But like I said, there is no OD on it, so as long as their vitals don't get too high or too low, then you can just keep popping it. It's not like you give them 3 and they're gonna drop dead on you. So you can get
practice. You just work within that 2-minute window, or are you still going to be
so adenosine.
vitals for the whole time?
Yeah, so epi gives a 5% bonus to the CPR and AED, but it does not stack as far as we've been able to test. So if you're giving more than one epi within 2 minutes, you're just wasting resources. But if you just walk up to somebody and just pop a second AED, it's not going to hurt. It's not going to hurt anything. The only negative is that you're just wasting it, basically. So after 2 minutes, you'd reapply it to get that 5% bonus back. So that 5% bonus does go away after 2 minutes. Okay. Adenosine, the way it works, you pop adenosine, it lowers their heart rate. It lowers it pretty quickly. It's like within 30 seconds, it'll drop to its lowest setting, but then it'll slowly start creeping back up, and then after 2 minutes, their vitals will return to normal. So that's all that 2-minute timer does. Okay. So if you miss the adenosine part, I like to just pop to adenosine like almost immediately as soon as they have a heart rate, as long as it's above, if it's above like 115, I'll just give them 2 right off the bat. It's not going to hurt them. It'll get their blood pressure or heart rate down much quicker, and then you can just slap them awake much quicker. All right. Okay, so we covered AED.
You should always check the damn triage card before you give any medication.
Yep, so triage card is in the top left of the medical menu. But like I said, there's no OD. So if you give somebody something, there's a lot of leeway. Now, if you sit there and you give somebody, 20 adenosines, you're going to drop their heart rate down to eventually they'll just pass out. Okay, and you'll have to revive them. But the biggest,
User joined your channel.
the triage card, I like to check it for morphine use, because morphine really screws up everything.
Yeah, I'm saying a lot of these guys start popping morphine and shit.
Yeah, so we'll get into morphine here in just a little bit. Let me just finish up
User
on the
joined your
AED
channel.
here. So AEDX, you want to carry it, that's fine with me, but just know that if you go down and you have an AEDX, nobody can use it on you. So to me, the 20% bonus that you get jumps up from 60 to 80, especially since you can spam AED with no repercussions. It just doesn't make sense to me to carry that.
Microphone muted.
Because if I go down, I want somebody to walk up to me and be able to shock me. That's why I like to carry it. So if you're a non-medic and you're working on 1-9 or Banshee, somebody that can carry it, or like Ogre Medic can carry it as well, it's under, click on their chest just like you would CPR, but it's not under advanced treatments like CPR is. It's where all the bandages are, under basic treatments. That's where you're going to find the use of the AED. Okay? Everybody understand that? Okay. Moving on. Okay, we can cover morphine now, I guess. Morphine, to me, does not belong in anybody's kit. Now, some people argue with me about that, but it has way more negatives than upsides. Painkillers is what you want to equip. If you don't know where to find that in the arsenal, it's under.
Miscellaneous.
Yeah.
Magazines.
Oh no, it's under the magazines.
magazines.
The one with not the single magazine, but
Three
the bulk
magazines.
magazine. Yep, 3
Microphone
magazines.
activated.
That's where you're gonna.
All available magazines. Yep.
Yep, you'll find
Microphone muted.
painkillers there. And it's in a weird spot, and you'll find ammonium carbonate there as well. It just
At the
has to
very
do.
bottom.
Yeah, it has to do with the way
Pharmacy book.
that it's coded, because each unit of painkillers and ammonium carbonate has 10 uses. Okay, so that's why it falls under that tab. It's just the way it's bundled. Okay, so if you
repack them.
yeah, you can repack them just like mags.
Can.
When you use one for there's a weird bug where it moves it to your uniform slot for some reason. So if you use one and all of a sudden it's if you carry it in your backpack, you use one, you go to check how many you have, it's probably moved to your uniform slot. I don't know why it does that. It's silly, but just know you get 10 uses out of each unit of ammonium carbonate and painkillers. For painkillers, you take 2 per pain level. So if you're in severe pain, you'd want to take 8 painkillers to get rid of severe pain. There is a little bit of a delay. So if you take 8, you need to, it's a couple minute delay before it'll actually affect you. So you want to be careful. I've had it glitch sometimes where I've taken 8 immediately and it did not get rid of my severe pain. It stopped at mild pain. So to counteract that, what I usually do is take 6. That always drops me down to mild, and then once I get down to mild, I'll take 2 more. Okay, that's just as a fail-safe, so I'm just not wasting painkillers. Sometimes it works, and sometimes it doesn't when you're on severe and you take 8 immediately. So that's just a tip there. I like to take 6, wait till it drops down to mild, and then take 2 more. Morphine. If you take morphine, you have to understand that it stays in your system for 30 minutes. Okay, and the biggest drawback with that is if you go down and there's no medic available to work on you. Because if you go down and let's say they revive you, your heart rate's going to be in the 40s, high 40s, low 50s, maybe even in the 60s.
I've seen
And
65
it's going to
to
stay like
45.
that for a very long time
Microphone
until
activated.
that 30 minutes runs out and gets you back to normal vitals.
Yeah,
So you could sit there for 20 minutes uncon with a heart rate and nobody can get you back because let's say your medic goes KIA and you're a rifleman and somebody gets you up and where you would normally wake up, now you're going to sit there for a long time uncon. And to me that's just unnecessary. So you're doing yourself a great disservice by using morphine. If you do use morphine or somebody gets a heart rate, you're doing CPR, whatever, you're a medic, and their heart rate comes up in the 60s, it's real low. Mostly when you give somebody CPR, their heart rate's going to be high when they first revive. So if you get a heart rate back on somebody and it's super low, check their triage card because most likely, almost all cases, they took morphine.
Anything below 70 is a telltale sign of morphine.
Yep, exactly. So when to counteract morphine, you have to use naloxone. Now naloxone works in a 1-to-1 ratio, and it's another one of those things where make sure you click on their head. Okay, if you're clicked on their chest, it's not going to work. So just remember, if it's auto injectors, you have to use their limbs, adenosine, epi, stuff like that. Make sure you click on a limb, arms or legs. CPR, AED, make sure you're clicking on their chest. To slap someone awake, reorientate, it's make sure you click on their head. Same thing with any of the pills. Ammonium carbonate, naloxone, that's all goes in through their head. So if you're not clicked on their head, the option isn't going to show up to use it if you ever get confused on where to find that. So if somebody takes 2 morphines,
Volunteer.
Somebody takes 2 morphines. Oh, he's really fucked up.
Hey, Seafolk, do you want to
Yep.
show them a morphine overdose, what it looks like? I'll be a willing patient.
No, we don't need to.
Come on.
Normally I would save his life, but he's kind of interrupting, so I'm not even gonna bother. He can sit there and listen to me talk
He's
now.
full dead.
No, he's dead.
Oh, he's okay. Good. All right. So, if they've taken 2 morphines within 30 minutes, you have to give them 2 naloxone, okay, to counteract that. So don't just give them 1 and think that you're
User
gonna
left
be
your channel.
okay. So if you give them 1 and shit still isn't working, give them another
User
one.
joined your
You
channel.
can't overdose on that either, so you can just keep popping them if you're unsure. But usually, it's going to be no more than 1 or 2. All right. So use pain pills. Make sure you're telling your guys. Inform other guys. If you see somebody take morphine, or they're talking about taking morphine, try to encourage them to take pain pills. Mainly because of the fact that if a medic goes down, there's no 1-9, there's no Banshee, which you guys
User
know
in
if
your
you play on the
channel
server
timed
long
out.
enough, that happens all the time, where non-medics are getting you up. If you've taken morphine, somebody who is not a medic is not going to be able to get you up. It's just not going to work. You're going to be sitting there until that 30-minute timer runs out before anybody can get you back up. So just don't do it. As far as the other medications go, I'll talk a little bit about norepi or norepinephrine, which works
User
like
joined your channel.
epinephrine, except it affects your blood pressure. The only reason we're concerned about blood pressure is you can wake somebody up with ammonium carbonate on any blood loss. Okay, as long as their blood pressure meets certain specifications. So if you are in a hurry, you got a lot of guys down, you're just trying to get guys up as fast as possible. If they're not on if they're lower than some blood loss, which is the requirement to slap somebody awake, you can get them awake by manipulating their blood pressure. The systolic number, or the big number, the first number, needs to be between 110 and 130. Okay, so if you can get their blood pressure between 110 and 130, even if they're on lost a large amount, you can give them ammonium carbonate
User left
and
your
they'll wake
channel.
right up. Okay, so it's very useful, especially if you're trying to get guys back up in the field as quick as possible, to use that ammonium carbonate. Most of the time, they'll get to some blood loss, pretty much throughout the whole process of just getting them bandaged, and you can get them to some blood loss pretty quickly. This is really only benefits if somebody is on like lost fatal, and you get to lost a large amount, and you get a heart rate, and you've got a lot of time before the blood is going to do its thing and get them up to some blood loss. Then you can worry about manipulating the blood pressure. But most of the time, just using adenosine and to get their heart rate below and just smack them awake is the way to go. Ammonium carbonate, you have to click on their head to administer it, and so it's not like, so it is like slapping, same thing. Click on their head. That will show up in, that one is under medications, right? Or does that show up under?
It will show up.
Under head.
It'll show
no,
up
but which?
basic treatments.
It's basic.
Okay, yeah, so that one, okay, same as reorientate.
Mm-hmm.
So that's where you find that in the medical menu. The rest of the drugs, honestly, if you never touched or knew what any of them did, you're not really, it's not that big of a deal. Okay, that gets into just kind of you're manipulating blood pressure and heart rate. But on this server, the way the settings are, it's really not that necessary to carry anything other than adenosine, epi,
Naloxone.
and yeah, naloxone,
What Narcan?
Narcan for medics. Yep, you want to carry that so you can get rid of morphine.
Naloxone.
You want to carry that so you can get rid of
Nitro.
morphine.
Naloxone.
Yeah, nitro. That one I very rarely use. That will lower their blood pressure, but usually most of that, by the time you're getting to that point, if their blood pressure is too high, typically they already have enough
User joined your
blood in
channel.
their system, or they're just like severely tourniqueted up. That will give like a really high blood pressure. So there's usually other ways you can go about it. It's not that necessary. That's getting to very advanced stuff that is. It only comes up like, I don't know, 5-10% of the time. So I'm not going to really cover that here. There's lots of other people do the advanced life support and go over each drug, and that's a good place to learn that. But for all purposes of this training session is just to try to make everything as efficient as possible. So for me, the rest of them are just not that big of a deal. Okay, so let's say you have 2 people that go down. Okay, first thing you do, if I walk up on somebody and there's multiple guys down, the first thing I'm going to do is I'm going to check to see if any one of those guys down is a medic. You want to prioritize medics. It sucks for the other guys, but if you can get a medic back up in working action, then that's just one more hand who can help deal with everybody else. So people go down, prioritize 1-9 and Banshee, and then medics, and then everybody else. Okay? That's just the way it works. To try to get everybody up as efficient as possible. If you prioritize somebody who's not a medic and your medic is bleeding out right next to you, then chances are they're going to bleed out, you're not going to get them back, and then you're going to be stuck out in the field without a medic. So try to get the medic up first. To reiterate, as long as you can carry them or drag them, they are still alive. Okay, so get on them, tourniquet limbs, bandage head and chest, and then start CPR. Do not worry about bandaging limbs until you get a heart rate. Okay, just prioritize getting that heart rate. As long as they're not on fatal, they will get a heart rate. You might have, like I said, you might have to do it 15, 20 times, worst case scenario, but just keep doing it. There is sometimes, every once in a while, somebody will go KIA and you've given them 20 rounds of CPR. It's just kind of the way the dice rolls. You just got really unlucky, or they were glitched. Okay, so don't think that you're doing something wrong. It's just every once in a while that shit happens. Alright? So, tourniquet limbs, head and chest. If you are a medic, tourniquet limbs, head and chest, start doing CPR. If there's somebody around you, have somebody else take over CPR so you can move on to the next person and start working on the next guy. Okay, and that's how I like to do it as a medic. If you have help, don't be afraid to call over your squad mates and be like, hey, I need help. You've got 2 to 3 guys down. I need help over here doing CPR or bandaging. Have your squad mates help. Most of them will be happy to help out. Okay, unless they don't know what they're doing. But most people will stop what they're doing and come and help if they can. Okay, so micromanage at that point. That's okay. It's one of the few times I like micromanaging. Tell the guys what to do, because otherwise you'll have a bunch of guys standing there just watching you and not knowing what to do. So, as a medic, I like to tell people just to tourniquet. Tourniquet arms and legs, and then I will work on the bandaging. Because as a medic, sometimes, and Adam, maybe you know the answer to this, but I have never figured out why it does it, but there are times where a medic role will apply a bandage faster than normal.
It depends on the wound.
Yeah, okay. So I just tell the other guys to tourniquet, because that takes the same amount of time no matter who you are, and then as the medic, sometimes you get the bonus where you can bandage them, their head and chest, a lot faster than somebody else would. So to work on that, have somebody start CPR, and then you just move to the next patient. Tourniquet, bandage head and chest, and work on CPR if there's only 2. If there's 3 and more, everybody knows that that's mass cas, right? If you don't, 3 or more down around you is a mass cas. For those of you who don't know, get somebody on the radio. If you have a maskaz, which is 3 or more, don't call a maskaz for 2, okay? Or if your medic goes down, don't call a maskaz for that. Doesn't mean you cannot contact 1-9 or Banshee. You can still do that, but don't call it a maskaz, okay? So that way everybody knows what they're walking into. And they might leave a situation where there's 2 guys
User
down to
left
go
your
to the
channel.
maskaz, and if they're showing up and there's only 1 guy down, you're probably going to have some pissed off people. So when there's a maskaz, if your medic is down and there's a maskaz, you can reach 1-9 and you can reach Banshee on either 31 or 39, channel 39 or 31. So don't feel like you have to switch to 39. If you're already on 31, just call 1-9 or announce the maskaz right on 31. Okay, it'll be just as effective as switching over to 39. Okay, so don't feel like
you should be on 39 to start with.
yeah, medics will be on 39. So if you're already a medic, you can just call it right out on 39. Not that big of a deal. But if you're not a medic, if you're FTL or squad lead or, whatever role you have, and you're already listening to 3-1, then just call it out on 3-1. Don't worry about switching. It just wastes time, and it's really not necessary. Everybody who's important, who needs to know, will be listening to both channels. Okay.
Just be careful when it comes to calling out maskazes. Go through 1-9. Don't go straight to Banshee. Depending on who's running 1-9 or Banshee, they'll probably be fine with it. But technically, you're meant to go through 1-9 and then 1-9 dispatches Banshee or himself. So just be careful with that.
Not necessarily.
Yeah, well,
Well, it is. You're meant to go. All Banshee missions go through 1-9. It's in the SOPs.
Exactly.
Stewie's English is getting so much better.
Hey Ryan, go and yell.
it doesn't really matter, but as a general courtesy, yeah, I always like to call all my maskasses to 1-9. To me, the only people calling Banshee, unless 1-9 is down, or if Banshee is very close by on C-Tab, you can talk to them directly, but just go through 1-9. It just helps the process a little bit better, because 1-9 usually has a better grasp on where to send people. It might not be against SOPs, but just to kind of streamline everything, you don't even have to contact 1-9. You just be like, just go on 31 and be like 1-1 is maskcast. Okay, it can be as simple as that. Or go on 39 and say 1-1 is maskcast. If you want to use a call sign directly, as Stewie said, I do like to go through 1-9 just to kind of simplify the radio traffic. The grand scheme of things, it doesn't really matter per SOPs, but yeah, what's that?
It is in the SOPs already.
Okay.
All requests must be conducted through 39 or 30 by 19 or 16.
Yep. So yeah, Banshee really should be directed by 1-9 in my opinion. So if you call Banshee directly, then they might have to call 1-9 to ask for permission, and you're just creating a middleman. So just go through 1-9, or don't say a call sign at all and let them figure it out if you want to be quick about it. Does everybody know how to change the radio?
Yep.
Okay.
Yep.
Samurai, do you know?
Yeah, I know, but
Okay.
I don't know how
good.
to change my radio, Seafolk.
Okay. Control P.
I was joking.
Okay. Does everybody know how to set an alternate?
Yo.
Okay. Just at yeah, pop morphine and your radio will automatically change. No. Control P. Make sure if you do set an alternate, you switch back to the non-alternate channel. Otherwise, it's going to screw up your settings, and you're not going to be able to use your alternate settings properly. So just make sure your radio is set to the non-alternate channel. Okay, the one without the A, or channel 1. All right. And you can, I'm not going to go over keybinds or anything because everybody has those changed, but T, I think, is the default for your alternate. Okay, as far as kits go, oh, no, let me back up. Plasma. This is a big one, and most people have kind of gotten this information. I've still found on the last map there's a lot of people not up to date with plasma, but plasma is the most important fluid you can carry. In fact, even if you're a non-medic, we didn't have any default kits on this last map. So for those of you who started on this last map, and have only run that one, you might not be familiar with the default kit, but typically maps have, there's an abundance of default kits set up, and they usually have saline. You want to carry. Okay, I'm going to take a step back here. Everything that you are, so when somebody does medical on you, they are using your stuff, your bandages, your tourniquets, your splint, your medications first before they dig into their own inventory. So if you can carry stuff like that, like 2 EPIs, carry 2 EPIs, that pretty much guarantees that somebody will be able to use an EpiPen on you. Okay, because if you've been out in the field a long time and the medic is out of supplies, runs out of Epi, you're not carrying it, well, guess what? Now they can't use Epi on you. Same thing goes with fluids. I like to carry, so the default ones usually supply you with, I think it's 250 milliliters of saline. Just get rid of the saline and switch them to plasma. The reason we always want to use plasma first before anything is it has natural clotting factors. Those of you who took a break for a little bit, or the new guys, you'll notice that you'll get shot a few times and you'll check your medical menu and everything is blue. Okay, that is the natural clotting agents from the plasma doing its thing. Okay, it basically applies a bandage to you every 2 minutes, I think it is. Everybody starts off with 10 clotting factors. Just right off the bat, that's default. 500 milliliters of plasma will replenish 10 clotting factors. So if somebody goes down and they need fluids and you push 500 milliliters of plasma, you'll notice that those wounds every 2 minutes will actually start to heal themselves because those clotting factors are doing their thing. With clotting factor, you can have a maximum of 20 units of clotting built up in your system. Everybody starts off with 10. If you were to give yourself 500 plasma, an IV of 500 plasma, you will now increase your clotting factor
User
to
left
20.
your channel.
It's a maximum of 20. You cannot go above that. So there's no point in trying to go more. 500 milliliter or 250 of plasma will give you 5 clotting factors. 500 milliliters of plasma will give you 10, and 1,000 of plasma will give you 20.
User joined your channel.
Okay, so when somebody needs fluids, just always give
User
plasma.
joined
So
your
when you're
channel.
dealing with your kits, plasma is what I prioritize the most. Okay, everybody understand with plasma, how plasma works? Any questions on that?
I just have a general question about a kit in general. So when setting it up, what would you suggest focusing more on? More bandages, more medicines, more fluids? What
As
would
a
you
medic?
have? Yeah.
That's a good question. Let me go through some more stuff, and we'll kind of naturally work our way through that. Okay. And I might answer a lot of that stuff as we go. Okay.
Roger that.
So to touch on fluids some more, fluids, they all flow the same rate. Okay, it used to be that saline was faster, and then they changed it, and then they changed it back, but right now, it doesn't matter. Saline, blood, plasma, they all flow at the same rate. Okay, they will even flow if you do not have a heart rate. When you do not have a heart rate, it flows very minimally. So you'll want to do CPR, but if you were to put an IV or a fast IO into somebody and push fluids and got sidetracked and had to walk away, those fluids will slowly seep into them even if you're doing nothing to them. Okay, but the big thing is that all fluids flow at exactly the same rate. So it used to be that saline flows faster. So if you hear somebody tell you that, just correct them and just say that they've changed it and they all flow the same. Now, you'd want to carry multiple fluids because you can stack them. So if you were to stack 2 500 milliliters of plasma, it's just going to go to 1,000 milliliters and flow just like plasma will flow. So you don't want to stack the same amount of fluid. There will be no benefit to that whatsoever. But you can stack, you can push 500 milliliters of plasma and 500 milliliters of saline, and the fluids will flow much faster. Okay, so if you've got somebody that's lost blood, a large amount, it's pretty much anything other than some blood, I just always immediately push 500 plasma and 500 saline. Okay, right off the bat. You could even throw in 500 blood and it'll flow even faster. Okay, so always switch up what you're doing, which is why when you're carrying fluids, you want to make sure you're carrying multiple types, at least 2 different types. I like to carry, so in my medic kit, I like to carry 3 1,000 units of blood, plasma, and saline, 3 1,000 units of 500 milliliters of each one of those, and then if I have any spare room, then I'll add plasma. Okay, I've also had kits and been real successful where I just carry 2 different types, where I go like maybe, you know, heavy on the like double the amount of plasma, and then have that, and then just carry like saline or blood, or you make one of that saline or blood. That's the best way to do it, because make sure you're stacking those. If you're not stacking fluids, you know, plasma and blood or plasma and saline, then in my opinion you're kind of doing it wrong. You're just wasting time. So stack those fluids, get that blood flowing much faster. It flows so fast that I even find that it kind of becomes unnecessary to use a fast IO, unless they're for like 1-9 and Banshee, unless they're
User
on like
left
Lost
your
Fatal.
channel.
Yeah, Fatal. Then you'd want to use a fast IO, but even through an IV, you stack multiple different types of fluids, and it flows very quickly. Okay.
If you don't have fast eye, you can put an IV in both arms.
I don't know if that's true actually. If
What did he say?
Putting an IV in each arm.
Is that
I
It
don't-
doesn't change
No.
anything.
Nah,
Yep. Yeah, it doesn't work like that, unfortunately.
Hey, Seafolk.
Yep.
Are you saying that fast IOs flow faster than IVs?
Yes.
I
They can
was.
put in
Yeah.
chest cavities.
Here comes
That's
Apple
not true.
Community.
It's not true anymore.
No.
Okay.
Damn.
They flow the same as a regular IV.
Yeah, the default flow rate is 4 to 5 milliliters per second.
Okay. So fast IOs are then basically pointless now. All right.
Pretty much. Only time you should use them is tourniquets because it will cause your patient severe pain.
Yep. So yeah, that's a good point. Actually, fast IOs are not pointless. So if you, like before, I was talking about just tourniquet everything and only worry about head and chest, that would be a good time to throw in a fast IO just to save time of not having to worry about bandaging or wasting bandages on the limbs at that point. Okay. Just once you prioritize heart rate, just leave those tourniquets on until they wake up, and then tell them to bandage themselves or whatever, especially if you have multiple people down. You can, if a limb is tourniqueted, it's good to go. You do not have to worry about it.
I've
Okay.
seen a lot of these guys not carry bandages, except they let the medics do it.
Yeah. So back to what I was saying before, if you do not carry bandages on your kit, then you are wasting the medic's bandages. Okay? So if that's the way you want to run your kit, that's fine. But just know that if your medic runs out of bandages, doesn't get a resupply, and you go down and you don't have bandages on yourself, guess what? They're not going to be able to bandage you. So that's why carrying some basic medical stuff is just really helps out and really kind of guarantees that the medic will be able to assist you.
Yeah, carry
Okay.
15 each.
Yep.
Plus
Okay.
saline.
Yeah, so I would switch out that saline with plasma, so you get that clotting factor. Anybody have any questions about fluids?
I mean, I would also tell your guys to carry 4 tourniquets because
5.
I always carry
should
4
carry one
tourniquets
extra.
and 1 splint.
I always carry.
Okay, so yeah, on my regular kits I carry 4, but on my medic kit, on all my medic roll kits, I carry 8. Just because I don't want to be caught in a situation where I do not have a tourniquet. If you want to carry 6, that's even better, because if somebody removes that tourniquet, they are stealing your tourniquet.
If somebody else goes down, you're going to leave one for them too. So
Yep. So
to carry extras.
yeah, so it's carrying 6 would be, or 5 or 6 would be a good idea, just in case somebody accidentally steals yours, to make sure that if you do go down, people can tourniquet yourself. So don't think that those medical supplies are only for medics. Okay, they are extremely useful for everybody. Anybody have any questions about fluids? Okay,
No, sir.
so just to reiterate, plasma is the key. you should prioritize plasma always. If you walk up to somebody, they need fluids, plasma. Okay, blood and saline, they're only there to increase the flow rate for when you need to stack them. Okay, with plasma. All right. Let's see what else. For those of you who are Banshee or 1-9, remember that TXA can work through tourniquets. So if you're in that situation where everything's tourniqueted and you're just prioritizing head and chest, you can put in a fast IO, you can push TXA, and those limbs will eventually take care of themselves. Okay, it will flow through the tourniquets. So that's a tip a lot of people don't realize. Okay, bandages for in your kits, I carry as a minimum. So if I'm a non-medic, the only thing I worry about is quick clot and packing bandages.
User left your
Okay, that's
channel.
the only thing I carry. Do not carry elastics. If you're not a medic, they're pointless for reasons I kind of explained earlier. They just don't last long enough. The only way they're useful is if you can stitch them immediately. Okay, then elastic will work well. So if you walk up on somebody, they only have a few wounds, you could just throw a couple elastics on there and then stitch them. If it's like a 16-second stitch, you're really not wasting that much time, then you don't have to worry about it. But if they have a lot of wounds and you're using elastics, they're just going to start reopening before you even get through the whole process. So you're going to be doing 2 rounds of CPR, and then you're going to notice they've opened back up again, and it just becomes a huge pain. So don't even bother with elastics unless you're a medic role and you're planning on stitching very quickly. Okay, so I only really carry as a non-medic, I carry 10 packing and 10 quick clot.
I used to feel bandages the bandage.
Yeah, I don't really like the field bandages. I don't think they last as long as packing or quick clot. They do. They're better than elastics.
Yes.
But that's why, I don't hardly ever use them. In fact, when I get into them, it just means that I've run out of quick clot or packing. So to kind of cover that quick clot, I like to use for avulsions or cuts, basically anything that does not produce a hole. So you can kind of think of it as packing bandage you would use on like velocity wounds. So anything that you have to pack a hole with, use a packing bandage. Everything else can be quick clot. It does take longer to apply, but they last way longer. Like, I don't know, 5 to 10 minutes or something like that. It's significantly longer where you can put one on and pretty much not worry about it for quite some time. Okay.
Yeah, by the time it opens back up, you gotta have it stitched.
Yep, exactly. And with the plasma benefits, that's another thing. That happens every 2 minutes. So keep that plasma going. If you think plasma's closed like 10 wounds, just ask your medic, hey, I'm carrying a 500 thing of plasma or a 250 thing of plasma, can you just top me off? And that'll add the clotting factor. And your chances of waking up magically are significant because of that plasma. Because it basically stops your bleeding. And I don't know how many times where, especially the last couple maps, you get shot, it's a mass cas, everybody's wiped, people will just start waking up, within 2 to 5 minutes or so. So that plasma plays a major part in that. So make sure you're carrying that plasma. Make sure if you hear somebody pushing fluids other than plasma, then just let them know that they need to be prioritizing plasma. If you're sitting around after a long gunfight, you got a break, you've taken a point, and you've lost some blood, and you're carrying plasma, just have your medic top you off to make sure that those clotting factors are good to go and keep you alive a lot longer. Okay. What else? Anybody have any questions? That's kind of the gist of what I want to cover here. Basically, things just to speed up. Like I said, there's plenty of people will offer the advanced life support. So if you want to learn more about more of the other drugs, then attend one of those classes. But for me, I wanted to kind of keep it simple and just kind of go over what I consider absolutely necessary. The rest of it is, in my opinion, all just kind of fluff for when you're kind of fooling around and need to fine tune the stuff in certain situations. But those situations are very limited, and it's most of the time epi, adenosine, and CPR is basically all you need. Okay, especially with the clotting factor. Another big thing to keep that plasma flowing is most guys are going down and getting a heart rate, and most of the time they're still on some blood loss because that plasma has clotted the stuff. So keep that plasma going. Okay. For instance, in this kit, this is my Banshee kit. Okay, I guess let me talk a little bit more about like 1.9 and Banshee now, as opposed to. So for that, I kind of change up things a little bit. I don't carry as much blood because most of the time, we're just running in there as 1.9 or Banshee, and we're just shocking people and then moving on. So you don't have to carry that much blood. I would, in fact, as a Banshee or 1.9, as long as the medic isn't down and there's a working medic around you, then I prioritize getting the heart rate and then move on to the next patient. Let the squad medic deal with pushing fluids and deal with stitching. Okay, as 1.9 or Banshee, your top priority is using that AED to get guys with a heart rate much faster. Once everybody has a heart rate, then you can start assisting with stitching and fluids and all that other stuff. But get a heart rate, move on. Okay, if that means leaving them there with tourniqueted limbs, and even if all those limbs are red, but head and chest is blue and they have a heart rate, move on. Let somebody else deal with it or come back to it once you finish getting a heart rate with everybody else. Banshee, now 1.9 I carry a little bit more fluids than I normally do on Banshee, just because, a lot of times you're working by yourself, and so there might be more cases where you need fluids more so than you would with Banshee. But I'll just go over here. My Banshee kit,
User joined your channel.
I carry 16 IVs, or I'm sorry, 10 16 gauge IVs, 10 packing, 10 quick clot, 10 fast IO, 8 tourniquets, 10 adenosine, 8 epis, 10 lidocaine, 5 naloxone, 5 nitro, 5 norepis, and 5 phenylephrines. And that's it. I could probably get rid of the norepis and the phenylephrine and the nitro altogether, and I don't even think I would notice a difference. Okay, because I very rarely use those. When you're 1.9 or Banshee, lidocaine, lidocaine, lidocaine. Okay.
User left your channel.
If you are not pushing lidocaine when you are fixing broken limbs, then you are causing severe pain. Now, if the patient is already in severe pain, then you don't have to worry about the lidocaine. It's not going to get rid of severe pain, but it will prevent severe pain from happening when you fix their limb. Okay, so when you're 1.9 and Banshee, you're doing a lot of fixing limbs. So I make sure I have plenty of lidocaine. And my Banshee kit limits the amount of medications I have because we almost always have a medical crate with us at all times. So you don't really need to carry a whole ton of a lot of this stuff, especially if you're running around in a Vic. Just keep that stuff
User
in the
joined
Vic.
your channel.
Keep like 5 or 10 of each thing. Use it, go back, and then resupply. Okay, so then that's where you can prioritize, more mags or a lot of us, like I have 6 smokes on me, white smokes, in my Banshee kit because I'm using smokes all the time. I also carry an Android in my kit along with a tablet so I can use both of them. In my 1.9 kit, I'm going to carry more fluid. So like in my Banshee kit, I have 3 of each, 1,000 and 500. Okay, 3 of each. And that's just for if I run up on somebody that's on fatal, then that's when I'm using the thousands. I'll push 1,000 plasma, 1,000 blood, 1,000 saline if they're on fatal. Okay, right off the bat. If they're on large amount, then I'm using 500 plasma and 500 blood or saline, whatever I have access to. If it's on a lot of blood, actually large amount large amount I'm using 1,000 and 1,000 or 1,000 and 500. Okay, on a lot of blood, then I'm just doing 500 and 500. Anybody have any questions on that? No? Okay.
No.
No, sir.
Banshee. Fill up those vehicles with stuff that you need quick access to. So like smokes, mags,
Rations.
yep, rations. Fill up the vehicle inventory. Don't put it in a medical crate, just the stuff that you're going to use a lot of. Like if I roll up somewhere, I'm throwing a shitload of smokes. So I want a ton, I want like 60 to 80 smokes sitting in the vehicle or the inventory of that vehicle, so I can just hop in the vehicle and replenish that stuff without having to pull the crate. Just save some time. If you're 1-9, make sure you're pulling a crate. Okay, I see a lot of 1-9s running without a medical crate. At least pull it, fill it up with what you want. I usually put a ton of lidocaine and IVs in there because you're going to be going through those fast, and plasma, and then everything else is kind of, adenosine. So epis, adenosine, lidocaine, and IVs. Everything, and plasma. Everything else, I'll just add, whatever, depending on how much time I have. But that's the important stuff. Fill a crate. Even if you just leave it sitting there by the Ogre station, get it filled so that way if you need something, Ogre can bring it out to you and it'll have exactly what you want. Because if you haven't packed your own medical crate and they just give you one, a default one, it's kind of useless. Okay, you're going to have a whole bunch of stuff in there that is not really going to be helpful for you. So make sure you're pulling a crate, filling it up with what you think is going to be essential. Don't be afraid to throw in a couple extra AEDs or a couple extra surgical kits, just in case you find a medic out there who forgot to pack a surgical kit, or something's bugged and something's wrong with their kit, they didn't realize it was bugged or glitched or whatever. Okay, so those crates are pretty important. If you don't know how to do it, you go up to the Ogre pit, Ace interact with it, and it'll be like, it's under basic. Now the only thing is 1-9, if command has accidentally pulled 2 crates, then you don't get a medical crate, because command elements are only allowed 2 crates at one time. So if they accidentally pull an AT crate and a general resupply crate, then you're kind of screwed out of your medical crate. So that's why I like to get over there as quick as possible, make sure I pull that medical crate so somebody from command doesn't accidentally pull that general resupply crate, and then you don't have access to it anymore. Okay. So to maximize your kits, if you're carrying a bunch of those other medications, now they don't take up a whole lot of inventory space, but you'll notice, especially this last map, we were very limited on what we could carry, so you really had to start dialing things down and figure out what you don't use. So if you're a medic and you're constantly looking through your inventory on stuff that you don't ever touch, just get rid of it. Okay, it probably is not necessary. I think that's about it. So, to kind of go through, reiterate, brief overview, you cannot OD on stuff, so don't be afraid to just keep popping stuff. Somebody says, no, I already pushed an epi, don't worry about it, just push it. Don't waste the time to check it, check their card, just push it. If they're uncon, no heart rate, it's not that big of a deal. Even if they do have a heart rate, it's really, pushing 1 on accident isn't going to be harmful to them. Same thing with adenosine, pop 2 of those immediately. That's why I like to carry like 20 adenosine and put a bunch of them in my crate, and make sure if you ask for supply crates, they put some in there, because those adenosine, man, it's just you can get somebody back up so much faster if you just push 2 immediately. Okay, don't worry about 1 and then waiting to see. Just push 2. Plasma, carry plasma. That's your best friend. Tell people not to use morphine, mainly because if they go down and there's no medic around, this is what I tell people to convince them. If they go down without a medic who has naloxone, there's no medic around, and you go down, your regular squad mates are not getting you back up. Or if they do, you're going to be sitting there for, potentially up to 30 minutes before you wake back up, and that's just silly. So use pain pills. We talked about everybody knows where to find that in the arsenal, right? It's under the
General magazines.
Yeah, the magazine icon that has 3 of them. Okay, not the single magazine one, but the triple one. It's down there at the bottom. 10 uses in each unit. So I usually just grab, like if I'm a non-medic, I'll grab 2 of them, and that usually lasts me. If I'm a medic, I'll grab like maybe 5 of them, because there's always going to be people begging you for painkillers. But try to get guys to carry them themselves. Okay, as medics, don't be afraid to tell people, hey, equip that shit in the arsenal so you don't have to waste my stuff. All right. Helmet cams. Make sure you have a helmet cam. It takes up like no space in your inventory. It's like as much space as like earplugs almost. Fit a helmet cam on you. If you're not using a helmet cam, you need to figure it out and get one. You can have it in any part of your kit, doesn't matter. You don't have to have a special helmet that has the helmet cam. It just has to be equipped in your inventory. But as 1-9, and especially as Banshee, most of the time we're just sitting there watching helmet cams. And there are countless amount of times where we are radioing to your squad if we see that you're down but nobody noticed. Okay, because you can tell if you're down. We can also watch and we can see when the medic is down, or if there's like 3 guys in one squad is down. We don't even need to wait for somebody to call a mass cas. We can see it clearly on the helmet cams. Those things are extremely valuable. Okay, and they take up no space in your inventory, or very little space in your inventory, so make sure you're equipping those. All right, and make sure you get your guys in your squad to equip them. Super helpful for 1-9 and for Banshee. Tourniquets, always carry 4. If you're only carrying 2, so guys that are used to the default kits, this last map, we already mentioned they didn't have them, but that doesn't mean this next map won't have them. Most of the time there's only 2 tourniquets in there. Bump that up to at least 4. Otherwise you're going to notice guys are stealing your tourniquets, or you're going to be using, like if a guy goes down and you only have 2 tourniquets and they need 4, you're going to give them 2 of yours. Okay, so make sure, try to tell and teach your guys to carry a minimum of 4. That way we don't have to worry about 5 is better, 6 is even better. Like I said, I carry 8 in my medic role, just so I know for sure I'm not going to run out. Removing tourniquets. If I didn't cover this before, if you take off a tourniquet off of somebody, you are most likely stealing it from them, because remember, we use their inventory first, the patient's inventory first. So if you apply a tourniquet, you're using the patient's, but then you take it off, it doesn't give it back to them. It puts it in your inventory.
User left your
so
channel.
You're basically stealing it from them. So don't remove tourniquets until they're up, they have a heart rate, and then the first thing I do is, hey, take off your tourniquets. That's why you hear people saying that all the time. Okay. All right, that's pretty much it. Anybody have any questions?
Make sure they don't use fucking Ace Interact.
What's up?
Make sure they don't use Ace Interact on injuries and shit.
Oh yeah, don't always go to always use the medical menu. It's just way faster. Now if you're working on somebody in a vehicle, okay, there's a trick to doing that if you don't know it. Ace Interact on the vehicle and go to passengers, and then select that passenger, and then go to medical menu, and you can do everything in that medical menu to anybody in the vehicle. It doesn't matter. You don't have to be sitting next to them or not.
Yep.
So like if a driver or somebody goes down, like somebody in the passenger seat goes down, somebody in the back can just start going through all the medical menus, find out who's conscious and who's not, and you can do CPR right through the medical menu. Okay, you don't have to be sitting next to them. So that's a big tip, especially if you load into a Vic and you take damage. Just start going through Ace Interact passengers and start going down the list. I usually start with the driver first,
Do we still
and
have
then
the bag?
just start working on them.
We still have the bag where they don't show the carry a jag mark in the bigs.
They don't carry a what?
Do we still have that bag where it doesn't show the drag carry?
Yeah, so with they're in a Vic and they go KIA, there's no way to tell as far as I can tell. So you want to just assume.
Here's the way.
What is it?
Go into your options, or your add-on options, and then it's whatever whatever you look at people with. DUI squad radar name tags.
Okay.
Then scroll down, show unconscious is dead, tag that. So what it does is that if you spawn somebody in, like this guy right here, when I look at him, I can tell he's already dead. Because, oh wait, no, I fucked up my setting. If you have that setting unclicked, then their name tag will be green, which means they're alive. And if you kill
Okay.
them, then it'll turn grayed out.
Okay. Yeah, that's a good tip. So if anybody wants to figure that out, get with Adam. Add-on options. Okay, in the configure.
DUI squad radar name tags.
Okay, there you go. It's a good tip. Does anybody, for those of you who are not medics, or I'm sorry, who are not 1-9 and or Banshee, and you're just running squad medic or even just a non-medic role, this AED on the ground will spawn a couple patients and just play around with it so you can figure out how to use the AED so you can see what it looks like, because to me that's super valuable. 1-9 or Banshee goes down, make sure you're using that AED on them. Okay? You can shock it as many times as you want. You can even shock them if they're still alive. It won't do anything. It'll cause pain, but that's it. Alright? Won't kill them. So don't feel all nervous like you're going to screw up and administer too many medications or shock them too many times. The way the server settings are right now, you don't have to worry about that. That doesn't mean
you're gonna overdose on is opioids.
Yeah, morphine. But even still,
Painkillers.
okay, yeah, more than 11 painkiller or more than 10 painkillers you will OD on. So, but they last 5 minutes. So as long as, after 5 minutes they wear off, so then you could take, more. So just be aware of that. But even morphine, you could give them 10 morphines and then just keep counteracting it with adenosine and they're not going to die. So there's no set OD limit except for those.
It's weird how it works with that Seafolk, is that it can do that, but I've had guys, I fucked around with it a lot where I was just giving this guy morphine epi, and I did it 4 times and he died.
Yep.
And then I gave it to him 9
User
times
left your
and
channel.
then he died after 9. It's weird how it works.
Yeah,
With morphine and epi, trying to counteract it.
because you're not. It's a range. So if you happen to get very high rolls on the morphine, but you're getting really low rolls on the range for epi, then it's not going to keep up with it. But if you were to give morphine and 2 epi, you could do that indefinitely. It's basically the vitals is the only thing that factors whether or not you OD. It's not the number of times you administer it to them. It's just if your vitals drop too low or go too high. That's the only time.
No, with morphine there is an OD number. With morphine, lidocaine, and painkillers. If you take too many, you'll OD on it. It's the pain values in it that fucks with you and it makes you pass out.
Well, I've given myself 20 morphine one time recently, and somebody just kept popping epi, and as long as I kept my heart rate at a normal
40.
range.
40 is the number that makes you pass out.
Yeah, as long as you keep it above that, then.
And then if your heart rate's too high, 190, it makes you pass out, and if your blood pressure is above, I think 290, you pass out.
Yeah. So, but on the safe side, just don't mess around with the morphine stuff. It's not that big a deal. For testing purposes, there should be absolutely zero reason you're giving anybody more than 1 morphine. Just the only reason to do it is if you're trying to purposefully cause them to go uncon. Okay, which is against the rules. All right.
Fluids. If you give somebody like 1,000 milliliters and they only lost a little blood, is it wasting the rest of the bag?
Well, yeah, it can be. Yeah. So if they're on some blood, but some blood is anywhere between
User
0 and
left your
900
channel.
milliliters. So you might need to give them 1,000 to clear out, to get them back to normal. So I don't think it's wasting it. But now if they're on some blood and you push like 1,000 fluids, yeah, at that point you're just wasting it. Okay, another thing too is you can take out an IV to help with your resources. Like if you're for 1-9 and Banshee, if you're putting in an IV only to fix a broken limb and push lidocaine, because lidocaine has to go through an IV, I just put the IV right in the broken bone. It doesn't matter if it has a tourniquet on it or not. It'll work through the tourniquet. I push the lidocaine, fix the broken bone, and then I take my IV right back. Okay, so that way I'm not wasting IVs as well. And then I go much longer without needing to resupply those. Same thing with fast IOs. If I'm using a fast IO on somebody and their blood loss gets back up to, some or better, I'll just pull it right out. It goes,
15 minutes.
yeah, it goes right back into your inventory, and like Treasure said, they will eventually fall out anyway. So if you don't take it back, now obviously if you're working on somebody that just needs a top off, you're going to lose an IV because you're going to put in an IV, push fluids, and walk away.
It
But
goes in the patient's inventory.
yep, if you're not using it for that situation, you're just fixing broken limbs, just pull it right away, and it'll save you a lot of IVs, a lot of hassle of having to just put that shit back in your inventory. TXA, I use it a lot, but it doesn't work that fast, so it's not super beneficial. But like if you walk up on somebody and you need to put tourniquets on them, I will push TXA if I want to heal up their tourniqueted limbs without having to remove the tourniquets and not wasting bandages. Then I'll do that. But at that point, you're just kind of killing time until the patient wakes back up. Okay? Any questions?
No, Mr. Seafolk.
Okay.
I don't think so.
So we can spawn. Okay, somebody who's never used an AED before, jump on it and use. Those AEDs are on the ground, so you can also place them on the ground, and then everybody. Oh god, shot him too many times. Spawn another one.
Training server.
Got it.
But this is another thing, as 1-9 or Banshee, you can throw that on the ground, and then even non-medic. Can somebody, Adam? Do you know?
Do the uncon one?
Non-medics can use them if they're on the ground, right? Is there anybody here not in a medic role? Like slot in a medical slot?
Treasure?
Yeah, you should be able to use the.
I can't
Anybody
use
should
it.
be able to use it.
I'm a medic and I can't use it. But I don't know, these patients are kind of bugged out. Let me spawn us some new patients.
Yeah,
User joined
mine
your
said
channel.
use AED station.
Yeah.
I used that earlier.
Yeah, the training server is a little messed up with the medical settings, so
It's very messed up with the medical settings.
yeah, so a lot of
Messed
stuff
up with a
doesn't
lot of
translate.
settings.
AED station.
No,
Yep.
okay, I can use
1-9.
it.
Yeah.
Yep.
Yeah, there you go.
Those patients are just fucked up.
Did you fall and die?
No. No.
Don't kill.
What? What? No, everything you said.
You don't spawn in
Yeah.
Stand
no,
clear.
Do you feel proud of your children?
Stand clear.
I do. We'll see what happens in the field. I'll feel better when everybody's doing good shit in the field. I might try to
stop
do.
the AED as a heart rate.
Check
Yeah.
the pulse.
Probably not anymore.
This is the best.
Nope,
part.
it is.
Stand clear.
Don't
There we
shock
go.
them.
If you guys have, who here has never worked on a patient before? jump in here and get some experience.
I've
Especially,
never worked on a patient before.
yes, okay. I know that's a lie. If somebody's lying to you, just give them 4 morphine.
Sorry, you're not right.
Put a
Sorry,
tourniquet on their arm
Seafolk,
and
I've never
put-
worked on a patient before.
tap.
Is that true?
What
No.
the fuck?
No.
Who brought the boo boo box?
Oh, nice.
Seafolk, I want to be Banshee if I never worked on a patient before.
Well, I don't. Do you need perms? You don't need perms
Yeah.
to slot in. Not on the
Good.
training server.
Oh, non-training server?
Nope. Nope.
Join Banshee 2, there's 2 open spots.
See. Hey, can Banshee get those for the next op, for the next liberation map?
It feels wrong to see Rusty be slotted in as Banshee.
I am Banshee.
I was gonna say it feels right now. Did you finally get yours? Your perms?
User left
Good.
your channel.
My ears.
Just trying to shoot Wade's tires out.
I wasn't.
No, he stopped.
We're done here for the most part, correct, Seafolk?
Yep.
Yeah.
Yep.